Well, I want to go back to something you said. It's been widely reported that prior to COVID, we were making significant progress in HAIs, that we were having rapid reduction in hospital-acquired infections. And then, as you mentioned, it's been well documented that post-COVID, we're seeing significant increases in hospital-acquired infections. We've really slipped back. You mentioned that you have data that correlates that to hand hygiene. Did I hear you correctly? Have you shown that hand hygiene has actually declined, which may be one of the contributing factors to the increased hospital-acquired infections?
Yeah, so as you're also sharing here, hand hygiene is not the only contributing factor. Actually, it's a multimodal strategy that's the only thing that will work. And even that won't be 100%. But we have very clear data showing that hand hygiene have a significant impact on some hospital-acquired infections. It's not all of them that hands have an impact on, but on some of the more serious ones, like when we're talking sepsis, for instance, hand hygiene have a very big impact on preventing them. So we have clear data showing that from multiple facilities, and what we pride ourselves in that we partner with university hospitals. They use our system, but they generate the data, they generate the research, and we help them in the publishing process of it. But it's not us who's creating the material, it's really them that's doing it. And it's back again to the trust I mentioned in the beginning, that trust in that hand hygiene actually matters is something that we're trying to support. Because believe it or not, it's not everyone who actually believes that hand hygiene is important.
Well, the CDC disagrees with that. They think that it's the low-hanging fruit. And of course, that seems to be the philosophy that's largely adopted, certainly in U.S. acute care. You mentioned it has to be a multimodality approach. We've actually seen some studies recently where hand hygiene compliance has been increased by measuring or by having disinfection of devices near hand washing stations. So if you have clean hands, that's fine, but it can be completely negated as soon as you touch a dirty device, such as a cell phone. Some people have speculated that cell phones now may be the most dangerous devices in healthcare because they're going to areas of the facility that aren't normally approached by other devices. And as I said, we've seen some interesting data that by setting up disinfection stations for mobile devices near hand washing stations, that we've been able to drive better hand washing compliance. Anything else that you have seen in your work that helps to drive the hand hygiene compliance by focusing on these other modalities?
I'll say I think what's important is to understand that the bacteria, they don't travel by themselves. So they need some sort of transportation means, that being, directly on the hands or on a phone that you carry or whatever it is, equipment that you move around in the hospital. I'll say when it comes to hand hygiene compliance, it's a cultural thing. So one of the things that we help facilities understand is that hand hygiene compliance is not the same for everyone. It's really a team that is consistent almost always on some very low performers and some very high performers. And depending on what type of culture you have, if you have a culture of when we say psychological safety, that you feel free to speak up and feel free to, for instance, tell one of your colleagues, "Oh, I think you missed an opportunity to wash your hands there." Those kind of cultures in teams have a way higher compliance than the others. And after being in a lot of different hospitals around the world, I can almost immediately feel when I step into a unit if they will have a good compliance or not. It sounds kind of weird, but I think a lot of IPC nurses and maybe even yourself can kind of read the atmosphere of where you're stepping in. So culture is everything when it comes to compliance with hand hygiene, but also other types of compliances.
Any future development plans around expanding the technology to some of the other modalities that you mentioned, or is the mission strictly focused on hand hygiene moving forward and expanding that solution into other markets?
So we've been focusing a lot of our time in Europe, building our base here, and that's kind of different from what's going on in the US right now, where there've been a system like ours for many years, and we are pretty much the only solution in all of Europe today. So what we've been focusing on lately is to broaden the way of utilizing the data that the system is gathering to help solve more challenges. So our strategy right now is to look at the different markets we are in and see what kind of problems can the existing data gathered by the system also help solve. And one of them that we started creating during COVID was contact tracing. So basically trying to see who might have been in a situation where they've been infected by either a coworker or another patient, and help the IPC team find the chain between the infections as fast as possible. It's actually pretty hard for them to find these connections today, and very time consuming. So often they actually have to give up because it's an impossible thing to do. But because our system through the hand hygiene data know who's been interacting with who, we can within a second show them who have been in contact with who, and who do they need to reach out to try and stop the outbreak.
So explain the contact tracing a little bit more. It's using the data of the hand hygiene usage, or are you using a infrared contact tracing element? Can you explain that?
Yeah, so maybe I should start off explaining a little bit how the system works. So the system is built for the WHO 5 moments for hand hygiene approach, which is before and after patient contact, whereas the CDC guidelines are room entry exit. And the reason why is because there is a lot of hospitals in Europe that have multi-bed patient rooms. So if you want to prevent infections from jumping between the patients inside the rooms, the healthcare workers need to sanitize in between patient contacts. Makes a lot of sense.
Sure.
But this also means that we have data on not just if someone was in the room, but if someone was with patient contact. So talking about contact tracing, just because you've been in a room with a patient doesn't mean that you've been infected with an infection. But have you been in close proximity to the patient for a longer duration of time? Most of the infections you can get infected with in these situations. And then what we know is we know where they travel from patient to patient, but also what other healthcare workers have been in close proximity to them, either by the patient or close to the soap and alcohol dispensers that are placed around the unit.
And how is that data managed? Is there a back-end cloud app, or how is that data managed by the practitioners?
Yeah, so we call it an analytics, and in this analytics, we don't have a focus on nitty-gritty figuring out who was compliant where and where not, because that's not really encouraging the safety of the healthcare workers, nor it is encouraging the positive reinforcement. So instead, we are sharing the data with both the healthcare workers and the charge nurses and whoever is responsible for the hygiene in the units, and the IPC teams, in a way so they can take action on it. And when we're talking about action, we don't mean going down to the low performer and saying, now you need to sanitize, because as I explained in the beginning, that is not driving improvement. So it's more understanding how can you change the culture of the team by making them understand where it is that they, as a team, needs to change their behavior.
Well, I know that you're based in Copenhagen, Denmark. Where are these solutions deployed today?
So even though we started off in Europe, we are the most widely used solution in the world today. So we are in most countries in Europe, we are in Asia, we are in the UAE, and until recently we are now also in the US. And I think what's interesting in this context is that we really understand how culture impacts compliance, because trust me, the culture between Singaporeans and Americans when it comes to hand hygiene compliance is quite different. Also when it comes to Dutch and Germans. So understanding that not everyone is the same is just very unique when you're trying to change behavior.
So these products, now, the first time we spoke, you were not yet in the US, but now you've expanded into the United States market. Is that correct?
Yeah, that's correct. So we had the opportunity to get our first hospital installed in Connecticut, actually installed last month. It's always interesting to see how it goes when you deploy something in a completely new country, completely new continent. It went very well. It was really interesting to get the feedback from the staff. I was a part of the installation myself. So kind of listening and hearing that, their thoughts are not that different from what we hear in other countries, and that we can kind of use the learnings that we have from Europe when we deploy in the US as well.
And can you share with us future plans for Sani Nudge, future development plans, expansion plans? What can we look forward to?
Yeah, so what we're doing now is that the hospital that we installed at and the other hospitals that we will soon deploy at, we all agreed with them that they will help us design new solutions using the same data. So some of the things that I hear when I talk with them is, for instance, automated nurse rounding solutions and asset tracking. So that those are some of the things. We already have the data in the platform, so it's just about displaying the data to them in a meaningful way so they can, improve their operations and their efficiency. And our strategy in the end is to improve the safety of patients and healthcare workers. So that's also the focus when we develop new solutions, that they need to contribute to not just the profits of the hospital, but eventually the safety of the staff and the patients.
Well, your mission is to improve hospital-acquired infections and healthcare outcomes. Through your experience with Sani Nudge, I'm sure you've been exposed to a lot of information, a lot of data. Based on what you know today, if you could wave a magic wand and change anything to improve hospital-acquired infection outcomes, what would you do?
Yeah, something that I think we've really learned over the last 7 years is that change doesn't happen by itself. So I think it's really great what the Leapfrog is doing now in the US, trying to incentivize hospitals to take in technologies. I think a lot of countries around the world could actually learn a lot from this. So I think if I could do that, I would take what Leapfrog is doing now and deploy in the rest of the world.
I think it's great that you mentioned Leapfrog. I think most of our viewers are familiar with Leapfrog, an independent rating system for U.S. hospitals. And of course, they just released their latest report, and the big focus is infection prevention, confirming what we know, that hospital-acquired infections have in some cases increased dramatically post-COVID. And I believe the data is from Leapfrog that you're 90% more likely to die in a D or an F hospital rather than an A-rated hospital from the Leapfrog system. So I agree with you. It's great to have that kind of third-party independent data that has some teeth to it as well. So good to keep people in compliance and keep the public in the know of who's doing things right and who could use improvement. So if people want to find out more about Sani Nudge, where should they go?
Yeah, so you can go to our website, which is saninudge.com. We'll also be at APIC next month, so you can also come and visit us there, where they can also visit you, I imagine.
That's right. We're Seal Shield's headquartered in Orlando, and APIC's going to be in Orlando this year. So it's a home game for us. We don't have to travel as far as you do, but I'm looking forward to seeing you there. Our guest today has been Theis Jensen. He's the CEO and co-founder of Sani Nudge. Theis, thank you so much for being on Clean Talk today. Until next time, I'm your host, Brad Whitchurch, reminding you to keep it clean.